Hi, Dr. Darty here with Chapter 10, True Confessions. I told my husband I needed to do this lecture, and he laughed at me. He is a physician as well. And I told him, well, it's the nervous system and mental health and their associated disorders. And he laughed. Well, here's why. Let's talk first about the specialists who deal with these various problems. Just a few to name. Neurologists. Neurologists are specialists who first trained in internal medicine and then completed their training studying disorders of the nervous system. Not to be confused with neurosurgeons. These are folks who started their training as general surgeons and then changed to a surgical subspecialty. They are literally brain surgeons, also spinal cord and a few other things, but primarily brain and spinal cord. Big deal. Then we have people who deal with how people's brains, minds, if you will, work. So we have psychiatrists who are medical doctors who then do several years of residency and sometimes fellowships in mental disorders. They can write prescriptions for psychoactive drugs. They often work in association with mental institutions, mental hospitals. Then we have psychologists. There are many different kinds of psychologists, but clinical psychologists have extra training beyond the usual degree in a lot of experience practicing, have to take exams to be able to counsel people who have mental health issues. So that's a clinical psychologist. Another route into that type of career is a licensed clinical social worker, an LCSW. You'll hear about them. They are similar to psychologists, although they've taken a different route to get there. And they too come at people who are having psychological problems from a slightly different angle. They often work with families or couples, but not exclusively. Let's see, who else do we have working in that field? That is most of the licensed professionals who would do that. Now, what do these people have in common? A, they all went to school for a very long time, a very, very long time, and they all had to pass several levels of rigorous training exams and put in a lot of hours in practice to obtain those credentials. Along the way, they developed an incredibly specific vocabulary encompassing a blue million terms. That is why my husband laughed at me, because to even scratch the surface of all the specialized terms in neurology and neurosurgery, psychiatry, psychology, we can't do that. So I thought maybe we'd just start with some very basic ideas about the nervous system, and we would talk about some of the words that are found in your chapter, in your book, in this chapter. So let's start with the nervous system. What is it? Two big divisions, grossly. We have the central nervous system, which is your brain and your spinal cord. Really easy, right? If it's the nervous system and it's not your brain or spinal cord, it's your peripheral nervous system. Peripheral meaning outside or on the edge. So your peripheral nervous system consists primarily of the branches of the nerves that come off your spinal cord and 12 pairs of nerves that come directly from your brain. It, of course, gets a lot more complicated than that. You'll learn the cranial nerves, some of you, later on. There are a lot of cute mnemonics for that. I think I listed some in the PowerPoint. Then you will also learn that in the peripheral nervous system, say the nerves that go to your hand and arm, incredibly fancy. As they go through your axilla or armpit, there is a network that would make the fanciest internet highway exchange, like you'd see in Dallas or Los Angeles, seem simple. It's called the brachial plexus. And nerves merge and then split apart. It's very tedious to learn, well beyond our scope. So, begin again, central nervous system, brain and spinal cord, peripheral nervous system, 12 pairs of cranial nerves, your spinal nerves, and the nerves that come off of those. All right, we can also divide the nervous system up functionally. So outside the central nervous system, those peripheral and cranial nerves that come out of your brain, they they can be classified as primarily either motor or sensory. That seems straightforward, but the meaning of those words to neurologists and neurosurgeons is somewhat different than we usually think of those words. Motor neurons, motor nerves, carry information away from the central nervous system. We sometimes say that they are efferent, E-F-F-E-R-E-N-T. You can think of it as exit. They take things away from the central nervous system. Many of them have to do with being able to move, but many of them don't really have to do with movement. When you are standing straight up at attention, all kinds of impulses are leaving your central nervous system to tell the muscles and nerves that, the muscles and joints that maintain your posture to stand in a certain way, even though you're not moving. So motor implies moving. Even more complicated, let's say that I tell you to think about, as I did in a previous lesson, I believe, think about a sour grape or a sour lemon in your mouth, and you'll feel just thinking about it that your salivary glands begin to produce more spit, more saliva. That is motor as well, because it was outgoing. Anything that's outgoing is motor, whether it moves or not. I know, it's crazy. I didn't do it. All right, incoming, which can be called afferent, meaning moving towards something, is called sensory. Now again, some of that is things you're aware of. I know that my feet are on the floor. I can feel the smooth top of this desk. I can sense the temperature here in this room, but not all of it. In fact, most of it is not at all on a conscious level. Right now, your central nervous system is getting bombarded with information about the state of your blood vessels, the amount of carbon dioxide in your blood, the amount of sodium in your blood, all kinds of things that if you had to stop and think about it, you wouldn't be able to do it and you'd die. So a lot of incoming sensory information is not something that you actually consciously sense. Now, I know those words are different, but important if you're talking neurology. Now, let's go down to the micro level. Everybody loves micro. The cells that make up your nervous system are called neurons, and they are the fanciest cells in your body, and boy, don't they know it. They are the divas of your body's cells. They are really busy. They take up an ungodly proportion of your body's energy to do their function. They are super special. That's why you can take this course to start with and learn these big words. Because they are special, like most special diva people, they have an entourage or posse that takes care of them. There are more cells to take care of the neurons, many more, than there are the neurons themselves. Collectively, all those caretaking entourage cells are called glial, G-L-I-A-L, glial cells. And there are several different varieties of them. If you want to know, take A and P, you can learn them. Among the most important are the astrocytes, which make sure that the neurons have access to the oxygen and nourishment from capillaries. They clean up the leaked neurotransmitters, more about that word in a minute, that the busy neurons tend to leak because they're sloppy. Someone else cleans up after them. So we have neurons and we have glial cells. The cells that are found in malignancies of the central nervous system, like brain tumors, are virtually always glial cells. An astrocytoma you may have heard of, or a glioblastoma, because those cells divide, whereas the neurons, except under very special circumstances, don't divide, or at least are very hesitant to. There's a lot of work being done on that right now, and if you're interested, you can Google it and learn more about it. But for a long time, it was the party line that neurons never divide. Probably not true, thank goodness, but again, beyond our scope. All right, so we have neurons and glial cells. Let's talk about the neurons. Neurons have a very busy cell body where they make chemicals called neurotransmitters. That's a group name. There are many different neurotransmitters, many, and we haven't discovered them all yet. But some of the classic ones you may have heard of are serotonin. That's thought to be important in regulating mood. People who have depression often benefit from drugs that enhance the amount of serotonin available to their nervous system. Some people think that's why we crave chocolate when we're upset, because chocolate contains a precursor of serotonin. Not sure about that either. Dopamine is another one. You may have heard of dopamine. Dopamine is what is missing in vital areas in Parkinson's disease. It's also very good at regulating blood pressure. So when we have a patient crashing, we may have them on a dopamine drip that tells their blood vessels to tighten up and raise your blood pressure. So those chemicals, and there are lots and lots of them, are called neurotransmitters, and they're made inside the cell body of a neuron. Now, extending out from the cell body, there's two different kinds of fibers. Dendrites are the short incoming fibers into a neuron cell body. Longer, much longer, sometimes multiple centimeters long, are the fibers going away from a neuron. These are called axons. Now, axons can ultimately join or almost touch a muscle cell, another axon, the dendrites of another neuron to pass a message along. You'll learn much more about that if you take A&P. But the place where they almost, but not quite, touch a muscle or another neuron is called a synapse, and the wee space is called a synaptic cleft. So the way this works is by a mechanism called depolarization. It's a chemical change in the electrical status along an axon that causes a neurotransmitter to be released and so on. Now, I know that sounds very complicated, and to be honest, it is. It's magically wonderful, but it's complex, and it takes a while to learn all the nuts and bolts of that. But at some point in your career, you might want to do that. Let's have a look at some of the words here that we might have missed. I think I talked about most of the important ones. It's interesting to me sometimes how your book groups things. It mentions right there on the second page of the chapter, the very first table, it talks about EEGs. That stands for electroencephalogram. Cephal, you may remember, has to do with your head, your brain, and electro, that's pretty self-explanatory. Gram is a recording. So an EEG or an electroencephalogram is a recording of the electrical activity in your brain. It has a lot of uses, but primarily they are done when we suspect seizures. A seizure disorder means you have abnormal electrical activity in the brain. They also do EEGs to determine if an unfortunate patient has any electrical activity in their brain at all. So EEGs are used also, sadly, to determine brain death. I think we went over most of these other words on the first page or two. And if I flip on over to 247, there's a lot more words, and I think actually we hit every one of those. Oh, one we missed, autonomic. Autonomic is the part of your nervous system, the function of your nervous system. It's exactly what you think. Autonomic means the part you don't control consciously. Now, you can regulate it if you do enough meditation or yoga, but in general, we don't really regulate our autonomic nervous system. It has two major branches. The sympathetic, which you may know if you've had psychology, is the fight or flight response. It's the get me out of trouble, help, I'm being chased by a tiger response. And the parasympathetic, which is known as restin and digestin, and since it plays a vital part in reproduction and reproducing. You can change your own words there if you like. Moving on. Oh, then they want to go into brain anatomy. The part in your book on brain anatomy differs somewhat from what you'll learn in A&P for those of you headed that way. It says your brain has 4 lobes and they list them for you. In A&P, you will learn that there's actually 5 lobes. They left one out in this book, and I will talk to them about it. But the frontal lobe is where you'd expect, here behind your frontal bone. It's up front in the frontal area. And it has your executive function, being able to calculate, a lot of your strategic planning. It's the last part of your brain to mature. It has your judgment. Some people think that's why adolescents sometimes don't use the best judgment and have more problems related to, say, auto accidents, things like that. It doesn't really mature in most people until their late teens or 20s. That's why they won't rent you a car until you're out of that age group. The parietal lobes are on the sides under the parietal bone, just where you would expect. The temporal lobes down here around behind your ears. And then the occipital lobe is here in the back. An interesting thing about the occipital lobe is that's where your visual, the neurons that do the work of processing the information from your eyes are located. I always think that's interesting. Why would they put it so far away in the back? Probably because it's very well protected back there and your sense of sight is so important. I don't know. The one they left out, just in case you're curious, because I know you are, is when your brain develops before you're born, it sort of rolls up like a cinnamon roll, and that means that part of the thinking or the business part of your brain, the cerebral cortex, that ends up actually inside as the brain develops and curls up, and that lobe is called the insular lobe. So there are some important functions of your brain located there. So we won't go through all that. Your brain is wrinkled on the surface. The sticky up parts of the wrinkles are called gyri, singular gyrus. And the ditches between them, the shallow grooves, if you will, are called sulci. One is a sulcus. And the deeper grooves that divide the two halves of your brain, your two cerebral hemispheres, that is a fissure. There are other fissures as well. And again, if you think, oh, but I want to know all about them, take A&P. They'll have you do that. Moving on, there are coverings over the brain, and collectively these are called the meninges, singular meninx. And to be honest, I don't ever hear anybody talk about just one. We usually talk about them in the plural, which is the meninges, and it's the same root word as meningitis, which you know is a bad central nervous system infection where those become inflamed. The three meninges are mentioned here, but the one that they want you to focus on is the dura mater. We have the dura mater. Under it is the arachnoid mater, and right on the surface of the brain, very delicate, almost like wet tissue paper, is the pia mater. The dura mater is just what you'd think. It's firm and tough. It's durable. The arachnoid mater, a funny name, isn't it? Literally means spider mother because the little capillaries that cross it reminded the early anatomist of a bunch of spider legs or a spider's web. And then pia mater means sweet or dear mother because it's very delicate and fine. The dura is important for a lot of reasons, but you will see it as part of some other medical terms that you'll come to know. You've probably heard of a subdural hematoma, where somebody gets conked on the head and has a collection of blood, exactly where you'd think from the name, under the dura but on top of the brain. If there's a lot of blood there, then it can start to actually push on and compromise brain function. But because it's so tough and tight, almost like an old-fashioned swim cap, it often restricts the amount of bleeding. More serious is an epidural hematoma. That's outside the dura. So the dura doesn't act like a pressure bandage there, and the bleeding from an artery there in the skull can go on unchecked. And in car racer accidents, Natasha Richardson's skiing accident, Liam Neeson's late wife, if you hear about an epidural hematoma, lots of times those are more serious and often fatal. So you'll hear about subdurals and epidurals. You've probably heard of an epidural spinal anesthesia, a completely different thing. That means that when the anesthetic, the numbing agent, is put into the spinal canal, it stays outside the dura, the little catheter that's inserted to put the anesthetic in to relieve pain. So those are terms you probably want to know. You'll hear them. Then they move right along into the third section to all the things that can go wrong, and they start with some of the things that strike fear in the heart of people your instructor's age. Alzheimer's disease, which is altered cognition. Cognition is your ability to think. The act of thinking is cognition. I think everybody knows what dementia is. They talk about sedatives, senile stroke. Stroke is the same thing as a CVA, a cerebral vascular accident. So we often say CVA. You may have heard of TIA, a transient ischemic attack. That's where there's a decrease in blood supply to some of the important neurons in the brain, but the effect is temporary. It clears up, but it can be a harbinger or a precursor of the more serious CVA. So TIAs are treated pretty seriously. They should be investigated so that we can take care of whatever was causing that. Then they move on to epilepsy. Grand mal epilepsy is what a lot of people think of when they think of epilepsy. Excuse me, my camera's going off. There we are. Grand mal epilepsy is the typical, we call it a tonic-clonic seizure, where the patient loses consciousness and has jerking movements of some or all of the body. But there are other kinds of epilepsy, which can be as subtle as just a very brief staring episode that often happens in preschool and school-age children. That's called petit mal, meaning little sick. Grand mal means big sick. So those are kind of antiquated terms, but they're still used. When a person has had a seizure afterwards, they may feel drowsy or confused, and we call that a post-ictal state. That means after a seizure. When someone is post-ictal and kind of still a little fuzzy, that's what we're talking about. I think everyone's heard enough about Tourette syndrome in the popular culture in the last few years. Then they move on to migraines and Parkinson's disease. Syncope, that means loss of consciousness. Sometimes you'll hear people say they hear that term from a physician and they'll say, oh, he had another one of his sinking episodes, because they heard syncope. It's not relating to sinking, but people do sink during syncope. That's one to mention. An aneurysm, you've probably heard the term. It is a ballooning of a blood vessel. It can happen anywhere in the body, in the aorta, in any of the big arteries. But when it happens in the brain, our concern is that it can push on other vital brain areas, or in worst case scenario, it bursts and causes bleeding in the brain, a CVA. Looking at all these words, really they want you to learn all these. I guess they do. Paresthesia is an interesting word, and it's a good one to know when you're writing in your patient record. You're recording the symptoms that they describe to you. You know, when your foot goes to sleep and then it has that weird tingly feeling as it starts to wake up, that's a paresthesia. It's an abnormal sensation, and it's often tingling or that pins and needles feeling, and it can happen for a variety of reasons, but that's called a paresthesia. Sclerosis. That brings up multiple sclerosis, and something I should have mentioned when we were talking about axons. Axons are coated with a material called myelin, and just like my charger here has a plastic coating over the wires that helps insulate the electrical impulses as they move along the charger. Your axons have a substance called myelin, protein and fat, but it serves the same purpose as the plastic coating on the wire. It isolates and also speeds up electrical impulses. Sometimes, and I have one around here, I won't dig it up, but I have one where it's breaking down because it's old, for another appliance I have here. The body mistakenly attacks its own myelin and eats it away, and that makes that nerve not work as well. That's what happens in demyelinating diseases like multiple sclerosis. And there are others, but I think most people have heard of multiple sclerosis. They're going to have us learn it all, aren't they? ALS, that's people have heard a lot about that through the Ice Bucket Challenge and other things. That stands for amyotrophic lateralizing sclerosis. And so you see why people usually say ALS. That is a neurodegenerative disease. The table on page 263 mentions some others. Poliomyelitis, which we usually just call polio. That's another disease of neurons. Moving on. They have some words on page 265 that you'll hear. Anencephaly means failure of the brain to develop before birth. It is not compatible with life. It's tragic. Microcephaly means a small head. It doesn't always mean that the brain didn't develop to its expected size, but it can. That's one reason that we measure babies' heads very carefully at their newborn and thereafter checkups, the first year of life especially. So we measure their heads. We get worried if they aren't growing, but if they're growing too quickly, then we start to worry, could this child have hydrocephalus? That's one possible explanation. Inside your brain, there are fluid-filled cavities called ventricles, and fluid is developed there to help cushion and nourish the brain, and it should flow down through a series of channels. Take A and P, you can learn all the names. into your spinal cord, and it's eventually reabsorbed back into the bloodstream. But if there's a blockage anywhere along that channel, the fluid keeps being developed, but it can't get out. So the ventricles become enlarged, pushing on the brain, and if a child's skull sutures haven't yet fused, the head itself can become enlarged, and that's hydrocephalus, treated in modern times in places where we have good health care with a shunt, which keeps the brain damage from happening. The shunt it's a plastic tube that takes the fluid out of the ventricle down through the neck. And in children, it usually is inserted then into the peritoneal cavity, and the body can reabsorb the fluid from there. Spina bifida, you may have heard of. Spina bifida is when, as the brain and spinal cord develop, the caudal end, the inferior end, the bones do not close the skin over the developing spinal cord, and so it's not protected, and the nerves are outside the child's body. In former times, this virtually always resulted in paralysis of the lower extremities and usually loss of bowel and bladder control. But these days, because it can be diagnosed earlier by ultrasound, many children are undergoing prenatal surgery where that damage, while it can't be completely fixed, is minimalized. Their babies are operated on before they're born, and they do better when they are born. They have better function. Moving on, they go through all the different ways on page 267 that you can study the nervous system, and I'll let you look at those. Then we move into psychiatric disorders. Right, we're going to learn all those? I think not. Let's antidepressant. I think everyone knows what that would be used for. Psychoactive is any drug that can cause a change in your way of thinking. A stimulant perks you up. A sedative calms you down. You probably knew those already. A tranquilizer is a sedating or sedative drug. A stimulant works the other way, like caffeine, that first cup of coffee in the morning. Then on the next table, they talk about things, and I bet you know most of these words already. You probably know delusion and hallucination. Homicide, there's a lovely word. Paranoia, everybody knows, I think, what paranoid means. Schizophrenia, people often have a mistaken notion of that. Schizophrenia is very complex, but because it means split schiz personality or split mind, people misunderstand the cardinal feature. It's a loss of contact with reality. So it's often accompanied by auditory hallucinations. People hear voices or they see things that aren't there. They're living in an alternate reality that is not the one that the rest of us live in. And if it's controlled with drugs, these folks do fine, but the key is that they usually need some medication to stay grounded in reality. Then on page 275, they go through a lot of different kinds of treatment, and I'll bet a lot of these words you already know, so I'm not going to go through all those. On page 277, there are a lot of different things like narcissists and psychopaths, self-mutilation, addiction. Again, a lot of these words are in the popular vernacular at present, and you probably know what they mean. Kleptomania, hide your purses. I thought of something. Do they have personality disorder? Yes, antisocial personality disorder. One distinction, and you'll learn more about this if you take psychology, is the difference between a person who has a neurosis, a neurotic personality. I've heard it explained simply that this means someone who thinks there's something wrong with them and everybody else is okay. They're very amenable to treatment, typically with talk therapy or cognitive behavioral therapy. People with neuroses are very often helped by psychologists, clinical social workers. If it's accompanied by depression, they may need prescription from a psychiatrist or their internist or general practitioner. On the other hand, personality disorders are deeply rooted. A personality disorder person feels like they're fine and everyone else has something wrong with them. And it is not typically as amenable to treatment. There's a lot of controversy about whether people with basic personality disorders can actually be, quote, cured, or even how much you can modify their behavior. But that's something I'm not a specialist in. All right, then they have a big table of different kinds of drugs, and a whole lot of them. And I'll leave you to look at those and see what you think is interesting. There's way too much material in this chapter, and that's why I very selectively and carefully chose the review questions so you would know exactly which things I expect that you should know for the quiz. It's a fascinating chapter. It's a lifetime's work to begin to understand everything in that chapter, but you got to start somewhere, so dig in and let me know if you have questions. Thanks for listening.